Good evening. Here the class is about the formulation of liposomes. The liposomes are formulated into 7 types. That is natural phospholipids, synthetic phospholipids, sphingolipids, glycosphingolipids, steroids, polymeric materials, and last one is charge inducing substances. Here the formulation of liposomes having these 7 types of sub classification, and here the first natural phospholipids are glycerol contain phospholipids are the most commonly used in the preparation of liposomes. We already know that glycerol is mainly used in the formation of liposomes, and saturated and unsaturated fatty acids in lipids are used to form the liposome. For the formation of liposomes, glycerol will be used and saturated unsaturated fatty acids also used in lipids to form the liposomes. Here, what are the saturated fatty acids and what are the unsaturated fatty acids? Here some examples of saturated fatty acids and unsaturated fatty acids. Saturated fatty acids means which are saturated in the fats, that is palmitic acid and stearic acid. Unsaturated fatty acids are palmitoleic acid and linoleic acid. Here oleic is there. And synthetic phospholipids. This is about the natural phospholipids, and second one is synthetic phospholipids. In synthetic phospholipids, the synthetic saturated and synthetic unsaturated phospholipids are there. That is dipalmitoyl phosphatidyl-choline. It is one type of synthetic saturated phospholipid, and dipalmitoyl phosphatidylserine. It is also a synthetic phospholipid. And here when we move to the synthetic unsaturated phospholipid, that is DOPC and DOPG. That is nothing but dioleuol phosphatidylcholine, that is DOPC, and dioleuol phosphatidylglycerol, it is DOPG. And methods of liposomes preparation. What are the methods of liposomes preparation? That is passive loading technique and active loading technique. Here the two types of techniques which is used to perform the preparation of liposomes, that is passive loading technique and active loading technique. In passive loading technique there is no classification is there, but when comes to the active loading technique, for the two passive loading technique and active loading technique contains 3 types of methods, that is mechanical dispersion method, solvent dispersion method, and detergent removal method. In mechanical dispersion methods, the lipid film hydration will be occurred by the hand shaking or freeze drying. This is the one type of method, and in this method when we shake that liquid, then the lipid film hydration will be formed by the hand shaking or freeze drying, or when we perform the micro emulsification method, the lipids will be formed. And sonification, French pressure cell, membrane extrusion, dried reconstituted vesicles, freeze thawed liposomes. These are the methods which is used to prepare the liposomes in mechanical dispersion method. And when we move to the solvent dispersion method, here the ethanol injection and ether injection, double emulsion vesicles method, and reverse phase evaporation vesicles method, and last one is stable plurimeral vesicle method. These are the solvent dispersion methods of preparation of liposomes. And when we move to the third one, detergent removal method. In this method, the detergent and dialysis method is there, column chromatography method is there, and also dilution reconstituted sendal virus vesicle envelopes are there. Okay, this is about the two. First one is formulation of liposomes and methods of liposomal preparation. And some representative examples of protein polymers which used for the nanoparticulates drug delivery system. Okay, the table which is indicate the representative examples of protein polymer which is used for the nanoparticulates drug delivery system. Here four columns are there, that is protein polymer, particular size. Particular size will be denoted in nanoparticles, and drug, or either maybe it also called as chemical, and their applications. Here first, protein polymer which is human serum albumin. In this human serum albumin, the particle size of the human serum albumin is 200 to 300 or 130. When we administer the ganciclovir, that chemical means you have to study from here. Okay, ganciclovir is a drug which is which is taken in 200 to 300 nanometers. It will bind to the human serum albumin, and the use of this ganciclovir drug is intravitreal delivery. Okay, by through the intravitreal delivery. And paclitaxel drug also, it goes to the, when it taken in 130 nanometers, it binds to the human serum albumin. And the application of paclitaxel is metastatic breast cancer. For metastatic breast cancer, this paclitaxel drug will be used. And most of the drugs in our body binds to the human serum albumin. Okay, loperamide is also, it is a drug which is taken in 200 to 240 nanometers particular size. It binds to the human serum albumin, which is used for the loperamide is used for the brain targeting drug. Okay, note down this point. And bone morphogenetic protein BMP2, it is bind to the bovine serum albumin when it takes in 200 to 400 nanoparticular size. The use of bone morphogenetic protein is bone tissue regeneration applications. Doxorubicin. It is a drug or chemical which is taken in 300 nanoparticular size, which is having 300 nanoparticular size. And this is binds to the gelatin. And the use of doxorubicin is cancer, magnetic targeting to tumor. That is nothing but cancer. And curcumin drug is having below or above 200 nanometers particular size, which is bind to the casein, and casein is mainly we can see in milk. Improved solubility and intracellular delivery of curcumin to tumor cells, mostly used for the cancer therapies. Curcumin, doxorubicin, which is the drugs used for the cancer. Blank particles. Blank particle drugs are contain 35 to 125 nanometer particular size, and it is bind to the silk protein polymer. Silk protein polymer, it will goes to the silk protein polymer and then it will bind. And the application of blank particles are drug and cosmetic delivery applications. The lectin conjugation is having 900 nanometer particular size, which is bind to the gliadin, and it shows the lectin mediated bioadhesive delivery system. When we came to the vitamin E, that is nothing but tocopherol. It is used for the antioxidant, which is a cosmetic delivery system. It is having the particular size is 900 nanometers. This is also binds to the gliadin polymer, and hydroxymic acid. This also binds to the gliadin, and which is used for the Helicobacter pylori infections mostly. And benzalkonium chloride, linolol, linyl acetates. These drugs will having the 900 to 950 nanometer particular size, and it is binds to the gliadin protein polymer, and which is used for the controlled release system of drugs for varying physicochemical properties. And essential oils containing 100 nanometer particular size, which is binds to Jane, and which is used for the controlled release of flavoring agents. This is about today video. Thank you.